Hey everyone, and welcome back to the channel. Today we're diving into a topic that's incredibly exciting but can also feel a bit daunting for many of us in the medical field. Choosing a research topic, whether you're a student, a resident, or an established professional. Figuring out a research topic can sometimes feel like finding a needle in a haystack. There are so many possibilities, so many unanswered questions. Where do you even begin? But don't worry, because today I'm going to walk you through a 7-step guide designed to help you navigate this crucial process. Think of this as your roadmap to research clarity. So grab a notebook, get comfortable, and let's get started on mastering research. Let's kick things off with step 1. Identify your broad area of interest. Connect with what genuinely fascinates you. Research is a marathon, not a sprint. There will be challenging days. Genuine curiosity will pull you through. Reflect on your experiences. What lectures made you sit up straighter? Which patient cases stuck with you? What health issues affected someone you know? Start with that general domain. Let your mind wander through medicine. Write down a few areas. What topics do you read about or discuss with enthusiasm? That's where the gold lies. In short, choose a broad topic that you care about and that has current relevance in medicine. Now that you've identified a broad area of interest, it's time for step 2. Conduct preliminary literature research. Start by exploring what's already out there and who the key players are. Think of it as reconnaissance. Use scholarly databases like PubMed, Medline, and Google Scholar. Focus on recent studies, review articles, and meta-analyses. Understanding what is already known will ground you in the topic. Second, as you review the literature, pay attention to limitations or questions raised by previous studies. These often point to areas that need more investigation. Take notes on recurring themes, unresolved issues, or any recommendations for future research that authors mention, as these are clues to where you could contribute. This groundwork is essential before identifying specific gaps. Okay, you've immersed yourself in the existing literature. You're getting a feel for your broad area of interest. Now comes the exciting part, step 3. Identify gaps and unanswered questions. A research gap, in essence, is an unanswered question, an unexplored area, a contradiction in findings, or limitation in current understanding that you've uncovered during your preliminary reading. How do you actively look for these gaps? It's like being a detective. As you read those review articles and major studies, pay very close attention to the discussion and conclusion sections. Authors often explicitly state the limitations of their own work and suggest directions for future research. Also, look for areas where findings are inconsistent across different studies. Beyond explicit mentions, consider what is being said. Start compiling a list of these potential research gaps or unanswered questions. By targeting a clear gap, you ensure your topic addresses a genuine knowledge need in the medical field. Remember, a good gap is one that is important to answer. Something that would advance understanding or improve practice if resolved. So, you've identified a potential research gap, or maybe a few, and you're starting to get excited. That's fantastic. But before you dive headfirst into planning your study, we need to tackle step 4, ensure novelty and significance. This is a critical checkpoint. Just because you haven't come across the answer in your preliminary search doesn't mean it hasn't been addressed. And even if it's novel, we need to ask, is it significant? Will answering this question actually matter? First, let's talk about novelty. This requires a more thorough and targeted literature search than your preliminary review. The goal here is to be reasonably sure that your exact question, or something very close to it, hasn't already been answered definitively. Next up is significance or relevance. Evaluating significance can sometimes be subjective, but try to think about the potential implications of your findings. A strong research question should address a real problem or knowledge gap that makes a difference. In other words, your question should be relevant to advancing medical science or improving health outcomes. By confirming both novelty and significance, you increase the value and impact of your research idea. You've identified a novel and significant gap. Excellent. But now we hit step 5, evaluate feasibility and scope. This is the crucial reality check. A brilliant, groundbreaking research question is completely useless if you don't have the means to answer it. Feasibility is all about the practicalities. Can you realistically carry out this research with the resources, time, and skills available to you? First, let's talk about time. Research almost always takes longer than you initially anticipate. Think about your own timeline. Are you a student with a specific deadline for a thesis, or a resident juggling clinical duties? Next, consider your resources. What will you need to answer your question? This could include access to specific patient populations, laboratory equipment, specialized software for data analysis, funding for materials or participant recruitment, or even just quiet space to work. Finally, let's address scope. As a quick check, apply the F of the finer criteria: feasible, interesting, novel, ethical, relevant. Your question should pass the feasibility test in terms of scope and ethics. We're getting close. You've got a novel, significant, and feasible idea. Now, in step 6, it's time to refine the question with specifics and frameworks. Use the PICO framework: population, intervention, comparison, and outcome. For example, identify who or what your question is about, a patient group or disease, what you plan to do or examine, a treatment, risk factor, or intervention, against what you are comparing it, if applicable, and what outcome you will measure. This helps ensure all key elements are clear. Craft a question so clear that others understand exactly what you intend to investigate. Avoid broad terms that could be interpreted in multiple ways. Be as concrete as possible about the concepts you will study. The goal is a research question that is narrow enough to be answerable, yet not so narrow that it becomes trivial. For instance, instead of asking, "What causes disease S?" a refined question might be, "How does a specific factor affect the risk of disease X in specific population over time frame?" This level of detail will guide your study design and makes it clear exactly what you aim to discover. Now we've reached the final step in our 7-step guide. Seek feedback and revise your question. Before launching your study, get fresh eyes on your question. Research is collaborative and external input is invaluable. Approach a mentor or experienced researcher for feedback. They offer invaluable insights. Present your question with context and rationale. Share key papers and be open to criticism. Refining a research question is iterative. Embrace the revision process. By the end of this step, you should have a well-crafted research question that has been stress-tested by discussion. This question will serve as the foundation for your study, so ensuring its clarity and focus now will save you headaches later. Once you and your mentors are satisfied that it meets the criteria of being clear, focused, novel, and feasible, you're ready to proceed with designing the study around that question. And there you have it, my 7-step guide to choosing a medical-related research topic. I know it might seem like a lot, but by breaking it down into these manageable steps, the path from a vague idea to a well-defined research question becomes much clearer and far less intimidating. Hopefully you now feel more equipped and confident to embark on this exciting part of your medical career. Thank you so much for watching today. Until next time, stay curious and keep learning.